For those that I don't know on the call, my name is Caitlin. I am the primary care engagement lead for the regional cancer program in the Central East region. So today we have Lisa Bell, who is a practice enhancement consultant with OntarioMD, who will be sharing a presentation on the optimizing the features of your EMR specific for cancer screening. So just a reminder that we will be issuing a certificate of attendance after this meeting. So if your name does not appear when you signed on, your full name, if you could please leave that in the chat, and that's how we will record that you were in attendance today. And then afterwards, after the webinar is finished, we will be posting it onto our YouTube channel, and we'll also be circulating some documents that OntarioMD will be circulating, and we've also developed some templates that can be useful. So I will turn it over to Lisa.
Perfect. Thank you. Hello, everybody. I'm going to get started by sharing my screen. And what you should be seeing is the presentation. We'll just swap out the view. Oh, there we go. And you should be seeing a full page view of the presentation at this point. Okay. Okay, so hello everybody and welcome to the session today. I appreciate that you're actually taking time out of your busy schedule to participate in this actual webinar today. So thank you very much for that. My name is Lisa Bell. I'm a practice enhancement consultant at OntarioMD, where I'm lucky enough to get to provide practice quality improvement guidance and support to clinicians and their staff. Utilizing the model for improvement methodology developed by Associates in Process Improvement, we're able to help with the full QI cycle if you're working on your CPSO QI, QA project, an OHT, or practice level QI initiative. Our advisory services team covers the entire province of Ontario. So establishing effective workflows and processes for cancer screening can help with early detection, which in turn provides a better chance for successful treatment. Today, I'm going to provide an overview of preventive screening best practice with the more common 3 EMRs that we find in Ontario, and that's Accuro, Oscar, and TELUS PS Suite. Each EMR has its own functionality, its own native functionality, and there's some customization available in some cases as well. But please note that they may be managed by an administrator at your clinic or for your group as well. Another thing to note is that we are going to cover a lot of content in a short period of time. So it's not a full-on training session, but definitely gives you a really good sense of some of the best practice guidelines. So often we find that the conversation is around primary care and practice enrollment models. So what I've done is designed this webinar so that we can include some of the resources that are relevant for non-PEM models as well. So in the format of this presentation is about 40 minutes to cover cancer screening, and then there's going to be time for Q&A at the end. So please keep yourself on mute when you're not speaking and use the chat box if you have questions during the presentation. While I'm presenting, I'm not actually able to see the participants or the chat box, but I do have some assistance with that. During the Q&A session at the end, you can still use the chat box, but I would really love it if you would actually unmute yourself and turn on your camera, and then we can kind of have a little bit of a face-to-face chat about things. So today we're going to be reviewing how to identify your patient populations, screening activities, follow-up activities, along with some useful tips and tricks. And then resources will be provided after the session. And OntarioMD is available for further assistance should you require additional coaching or support, or perhaps you'd like to register for our OMD Educates informational webinars. You can also view past recordings. And additionally, we have communities of practice for Accuro, Oscar, as well as TELUS PS Suite that run every couple of months if that's something that you'd like to register for. So let's get started. Accurate data is required for identifying patients who need cancer screening, and it's foundational for any improvement initiative. And this is often a root cause for preventive screening issues because with poor data quality, it's more difficult to find and follow up with patients who are overdue for screening. So if you've got poor or unreliable EMR data quality, it can erode a clinician's confidence for decisions. It can extend the time that clinicians and staff are searching and validating information, and it can cause some patient safety issues. So when we have high quality data in our EMR, it can help ease clinical workflow, improve decision support at point of care, and enable accurate performance measurement. So if you were to choose and review 5 random patient charts for patients between the ages of 50 and 65, how long would it take you per chart to determine if they were due for cancer screening? And how many different areas of the chart would you need to review? And at point of care, are you able to easily and quickly identify and see a patient's cancer screening status? Do you know how to use your EMR to find a population of patients who require screening? And if so, is this information accurate? And then, is the cancer screening data in your EMR reliable, accessible to all who need to reference it, and updated in a timely manner? So the purpose is not to make clinicians data miners, but to support best practice guidelines and make it easier to find the information you need for your patients when you need it. And this is where data quality comes into play, and it should be addressed to make your cancer screening activities easier to manage. So we kind of get started with patient panel management. And the reasons are, are you confident that you have a clean patient panel? Is the status of your patients accurate? Can you see who's active, inactive, where appropriate, what their roster status is? And do you have someone who's responsible for maintaining this? And what's that process? Can you identify patients to follow up with who may have left your practice and moved on to a new provider? So an example of this would be patients that haven't been seen for several years in your clinic. Patient panel management should be cleaned up first so that you're not following up with patients who are not part of your practice. And then think about the ongoing process moving forward. A couple of things that you have if you are in a practice enrollment model is the roster and capitation payment reconciliation report, or you could look to outside use reports that can help you keep that roster up to date. So in terms of standardization, I'm going to be talking about this a lot. So can you find your patient populations who are eligible for cancer screening? And of those, who is overdue, who's up to date, who's excluded, who's declined, or who had pending test results? And then you want to make sure that you're using the appropriate part of the cumulative patient profile, or the CPP, consistently. So when we're looking to TELUS, we're using the problem list or history of past health. In OSCAR, we're using the preventions module. When we're in a Curo, we're looking to the history of problems, med surgical history bands, and some are using the preventative care band as well. Where appropriate, use a diagnoses coding system for excluded patients. So when I'm referring to these coding systems, it's your ICD-9, your ICD-10, your SNOMED, or your ENCODES. You also want to make sure that you're using standardized naming conventions. And I understand that this gets very, very challenging where we have multi-clinician practices, but you want to consider how many ways breast cancer, for example, is documented in the chart. And if one person's using breast CA, another cancer of breast, another breast cancer, it finds it very, very difficult to find all of this information. Then you have the reports that are received within your EMR. And you want to make sure, and this is going to include scanned and faxed documents, you want to make sure that they're labeled consistently and meaningfully. So it's going to be intuitive to you what is actually in the contents of that report when you're reviewing the patient charts. So you can also use things, for example, like OLIS, but make sure you rename those reports when you pull them in, or it's going to be named Ontario Laboratory Information Systems. Something else to be mindful of is if you're getting reports from HRM, you can have operative reports that are coming in. And that's not really specific because it could be a colonoscopy, colposcopy, and so forth. So you really want to make sure you're defining that it is actually a colonoscopy, for example. You'd like to flag patients who fall outside of routine screening. And this could be patients that are high risk, or perhaps they've had abnormal results. And then for completed screening or excluded patients, you can use those tracking or exclusion codes to inform the Ministry of Health of screening for your rostered patients. So it's really good to get started with cleaning up your roster so that you're following up with the appropriate patients or your patient panel, and then also your data quality. And these two things are actually QI projects on their own if you actually need to do some of this cleanup. And then you can move forward more easily with developing workflows and processes for cancer screening. And I know that time is often a barrier, but some of the options could include utilizing a student or a volunteer to assist. You know, you've got your university student home for the summer, maybe we can put them to work for a little while, or break it down into chunks. You might be reviewing a certain number of charts per week. So your EMR should be a true reflection of your patients and their healthcare journey. And you want to ensure that your EMR is your source of truth so you can be confident you have the most up-to-date and complete information that's easily accessible and that all staff knows where to find it. There's a number of external data sources that you can use, and they're going to augment your EMR to make it as complete and up-to-date as possible. So an example of this is that you may find out that a patient had a pap test done elsewhere. You could go to OLIS, and if that report is available in OLIS, you could pull it into their chart. Just remember to label it properly. And while this is not an exhaustive list, some additional sources of data that you could use to augment your EMR. There's the Inspire primary care data for OHTs, and there will be links provided in the resource document. There's the Alliance for Healthier Communities with lots of resources, practice profiles, business intelligent reporting tools, etc. Formerly called Health Quality Ontario, we have the Ontario Health Quality Division. They have primary care reports, and they used to just be for your primary care physicians, and it would be their rostered populations, but they've been expanded for various models, including long-term care, hospitals, and so forth. And what this does is provide clinicians and administrators a comparison of overall performance using practice regional and provincial level data. You can also use Connecting Ontario, something that you could sign up for, which is a clinical viewer, and that may be able to help you find some outstanding reports that you don't have within your EMR. We do need to note that some of these things are going to need you to register for a OneID account, and that will also be included in the resources at the end. And then in terms of enrollment models, you have from Ontario Health, the Cancer Division, or Cancer Care Ontario, they have a screening activity report. And this is an online tool that provides screening data based on billing to help identify patients who've had screening elsewhere. You just want to be aware that it does come out on the 10th of each month, so you want to be mindful of potential stale data. There's a target population and service reports that come out in April and September from the ministry. And this gives you the list of cumulative preventive care services for enrolled patients. There's the roster and capitation payment reconciliation report. This is an electronic roster report received monthly, includes what the ministry has listed as your current roster and possible new additions or removal suggestions. And you could also use outside reports. So now that we have that out of the way, let's get into some of this cancer screening. So as a high-level process overview, this is basically what we're going to be doing when we're identifying patients all the way through to when we've got their completed tests documented in the chart. So we're going to start by identifying your patient populations. So your patients who are eligible for screening, and it's based on age and gender, patients that are overdue for screening, patients that are excluded. And you want to consider how exclusions are documented. So is it that you're using Q codes that are being sent to the ministry? Are you using a diagnoses coding system? Or are you using text, hopefully standardized text within the CPP? Or you may even be using progress or encounter notes. There's also identifying your patients who declined, and you want to consider how that's documented in the chart as well so that you can find that information. You might have text in the CPP, you might be using progress notes, you might have standardized stamps and things like that that you're using as well. Finding your patients that are up to date. And then this one's kind of cool is your patients who are coming due. So as we get out from underneath this COVID backlog that we're all experiencing right now, we could get to a point where potentially we can reach out to patients who will be due in the next couple of months and get them booked in for their appointment or get the requisitions prepared. And then there's also pending results where applicable. So some of the things that you can do to identify these patients, it depends on the EMR that you're using. There's something called collaborative quality improvement or your CQIP searches that have been developed for Akiro, Oscar, and TELUS PS Suite. And this includes a screening overview document. There's some support guides to help you. And then there's also been searches, queries, and report by templates or RBTs. The guidelines for these are breast cancer screening is females 52 to 69. Cervical cancer screening are females 23 to 69, and colorectal cancer screening is for patients 52 to 69 years of age. You may already have or the ability to create searches, queries, or RBTs to find not only your overdue, but your excluded, declined, etc. So in your particular practice, it may be that you have an administrator that can build out some of these things for you, or they can import them into your EMR. It's going to be based on permissions that you have. And additionally, you can reach out to OntarioMD. We're here for you for additional hands-on guidance and coaching for your cancer screening. So it's important to know where it is that you're starting from, and this is where identification comes in. From patient lists such as eligible for screening and overdue for screening, you want to document the number of patients that you have returned on your list and use that as your baseline, but you can also use that to calculate a baseline percentage. So this is where you are today, your number of patients overdue divided by your number of patients eligible and multiplied by 100. So from a quality improvement perspective, if you're setting your goal of what you would like to achieve or where you would like to get to, you could start with that percentage, say 48% of patients that are overdue for screening, then consider the percentage you would like to work towards. So it could be 20% and a date to have it completed by. And then this gives you a nice goal to work towards. So when we get into the reach out phase, this is going to require some testing or tweaking to come up with the best schedule and reach out format for your practice and your number of follow-ups and so forth. Or if you've already got current process, you might find that there could be a little bit of wiggle room for improvement. So basically where we're going to get started is delegate to specific staff members that are going to generate the patient list. And some considerations here are by whom? Who is it that's going to be responsible for running the list? What's the frequency of running this list to follow up with patients? And are you doing a particular schedule? So you could do maybe breast cancer 1 month, cervical the next, colorectal the third, and keep cycling that throughout a year. Or if you're working on a quality improvement initiative just on one type of cancer, then you would kind of determine how frequently and schedule out when you would be doing those reach outs. If at all possible, it's good to have private space and schedule time to work on this task without interruptions. I know it's not always possible, but if it is, fantastic. And then you want to follow up with your appointments, your patients to book their appointments or send in requisitions, etc. So if the patient doesn't have email, you can call them, inform them that they're overdue and schedule the appointment or have the requisition handled. If the patient has email and consent for you to email them, you can use a templated message to email patients, making sure that you use a secure messaging platform. And in some of the EMRs, there are some mass actions available to assist with that. And I'm not sure if anyone actually does this, but you can actually use regular letter mail that you can send to patients as well. And so some overall considerations are thinking about things like how many follow-ups you're going to do before you put a patient on hold, right? Like, are you going to email twice and then kind of put it on hold for a little while or leave 3 voicemails? You kind of figure that out. The order of your calls is something to keep in mind as well, because if you're always generating an A to Z list, there's possibly patients that are going to be missed. And then how to use EMR functionality to track pending reports and results. I'm not sure if someone's asking a question. Okay, I'm going to keep going. And this is an opportunity to have a discussion around screening hesitancy and to record refusals as well. So you want to make sure that you're empowering your staff with knowledge for those hesitancy discussions, or refer to the clinician, and being mindful of cultural or personal issues. You want to empower patients to make that fully informed decision. And if a patient refuses, then that should be documented in the EMR and consider the timeline to offer the screening in future. When we get into documenting and tracking, this allows you to track your progress and measure against your goal over time. So as patients are contacted, you can document the conversation or the sent message in their chart. You want to clearly define process for this with roles and responsibilities of who's going to take this on. And don't make it complicated. You can use a simple table in a spreadsheet to track progress along the way. If you have someone who likes to do this, they can develop graphs and run charts to depict your results. You can use a simple word table or whatever it is that you're comfortable with. And you can document your eligible patient population, those up to date, those who are overdue. You're going to start with the initial numbers when you first run your eligible patient lists. And you can either update it every 2 weeks or monthly or whatever your practice process is, and make sure that you keep tracking those numbers so you can track over time. And it can be helpful to document something that was super successful that you can capitalize on future, or perhaps any barriers or challenges that you encountered so that you have these for future reference as you're developing your workflows. And from a QI lens, you want to make sure you are tracking because you want to be able to measure if and how well you are progressing towards achieving your goal. And then we get into closing the loop. So pending tests require follow-up to ensure that they're not missed. It could be that the report was not sent to you or results are delayed. You want to make sure you have a process in place to identify pending tests and follow up on them so you don't lose sight of them. And also a process to immediately reorder tests where appropriate. So some considerations are this is different. Received results and reports can be labeled appropriately as well, so the patient is identified as up to date for screening. So again, you want to determine who it is that's going to review the inbox or they're scanning in reports. And then the process for report labeling. Is it done by a physician or a nurse or admin? Are these inboxes checked morning and afternoon so nothing's missed? And then where appropriate, you can build tracking codes in alignment with the date that the screening was performed. So we're going to get into some EMR specific tips and tricks. I would like to point out that the images are from a lab environment, so all the patient, physician, and other information is completely fictitious. Also note that the ability to add or edit is going to depend on your clinic or your group. Some may be done by administrators and so forth. This is not a full-on training. We're going to get into some details about all of the different functionality that's available to you. And if you find that you need some additional assistance, you can always reach out. We can go a little deeper into some of this. So when we're into a CURO, we can document exclusions and preventive care in the history of problems. The history of problems does have a diagnostic search window to enter codes, which is very helpful for standardization. If you're creating custom diagnoses codes, be cautious that you don't end up with an overwhelming list. So if you're doing breast cancer, breast CA breast, et cetera, and they're all available in that dropdown, it gets unwieldy pretty quickly. There's also the surgical history band in the CPP, or some do use the preventative care as well. These do use the managed list for consistency. And again, you can add new if you have permission to do so. Just use caution if you are. Preventive care reports can be generated, noting that each year a profile is going to need to be created, and you're probably going to want to use default because that's going to populate those mappings for the included and excluded service billing codes. So this isn't used for your year-round entire patient population screening. This is more towards your cumulative care bonus if you're in a practice enrollment model. So here we can see for colorectal cancer screen, in this particular instance, it was looking to March 31st of this year. We can see the age and gender and then included or excluded services. And when we generate this report, what's going to come back is your percentages. So the number of patients converted into a percentage of how many are up to date. So if we look at our PAPs, for example, 29 of 95 are up to date, which is 32%. So by March 31st of next year, you'd want to have a higher number available so you can get the higher bonus. You can then enable the preventive care tracking via the cog wheel, which is right here. There's different things that you can enable. And then when you click on the preventive care, you can kind of see an at-a-glance view of what the patient is overdue for. There is the query builder that's available within a CURO. And this is your ability to create a search. You can create them yourself if you have the permissions and you know how to do them. You can download them from the cloud. So when you're in the query builder, there's certain users that may share their queries that you could download and import into your EMR. Here we have an example of the CQIP cervical cancer screening query that's been developed, and you'll have access to that as well. So basically, you would generate your patient list. Here we can see the list of patients that meet the criteria or part of it. And then we have select action here. So there are some mass actions that you could take, like creating tasks for this group of patients. And so when we get into tasks, this can include pending or refuse screenings or patients that require their own schedule and can be assigned to a particular staff member who's going to contact patients that are coming due or overdue. So tasks can be viewed, they can be added or edited by using F7 from the encounter notes. They can be tracked in the tracking section in the encounter notes by, you click on the cogwheels that we'd shown a moment ago, or you could develop a query to find them. You can also you can create task reasons, and something like pending or refuse could be created. And you would have a drop-down list that's available. There's a manage option there so that if you are creating your own, you would just use that particular manage functionality. You can create these globally, meaning the entire practice has access to them, or you can create your own. There's also alerts that are available. And what an alert is going to do is add this little red exclamation mark. And it's at the patient demographic bar across the top of the chart. So what you're going to want to do is make sure include in tasks is circled when you're using your query builder or checked off. If this warning message field is left blank, you can type whatever you want in there. So in this case, needs colorectal cancer screening. If it's left blank, then when you hover over here, instead of showing needs colorectal cancer screening, it will just show the name of the query that references it. Reports received should be assigned the appropriate classes and subclasses when you're reviewing them. So in this particular example, we have a medical report that came in. It has that subclass of operative report, which isn't really intuitive for you. So what you can do is just kind of use this little button down here, the A to B, which is going to open up your update report class window. And that's where you can change the class or subclass and then make your changes. There's macros that are available. You can use this to have one word that's going to trigger a whole bunch of information that gets populated. So this gives you some easy, consistent documentation of patient reach out, for example. You could document if a patient is compliant for screening or if they had an abnormal result. So here we have abnormal, and all of this text associated to it would be populated as well. There is quick patient action, so particularly useful when you have a new patient, but you can also use this to be doing some quick entry while you're in there with your patient and kind of shortcut some of these things. You can add tasks and messages and so forth as well. The last piece that I'm going to show you is for tracking. So this is outstanding requisitions, referrals, and orders, also referred to as oral. So this is very, very high level. There's a full webinar on its own that's provided by Akiro that actually goes into all of the details for you. But basically what you're going to do is convert a standard form into a requisition form using the form editor, and that's going to allow you to track your requisitions. So when you order a requisition and you send it off, in the patient chart, you're going to see this red X here so that you know that this has been ordered, but it hasn't been reconciled at this point. You can view outstanding orders and referrals in the tracking section of the encounter notes by using your F7 to see tasks, your F4 to see your appointment view, or you can also look through Oro, and this is what this looks like here. It's quite busy, and this will show all of the outstanding requisitions and orders. You have different options here, like your providers, your type and status, those that are older than 6 months, etc. And you have options to reconcile or enter a new order. So then what's going to happen down the road is once your result is received, you're going to get a window that's going to pop up for you, and it's going to allow you to reconcile with the requisition that has been sent out. If there's more than one outstanding requisition, there could be more than one available, and you would just kind of click and reconcile on the appropriate one. And it closes the loop by putting that check mark here and replacing that X that was in the upper corner. Similarly, for referrals, you can use the new referral order. It's in a drop-down list when you're generating that referral letter so that it knows that you're going to need to track it. This is a global setting, so everyone in your practice is going to need to be aware that this is the functionality and to comply with it clinic-wide. So certainly within the Accuro help files, you can find more information on that, or you can even view that webinar that Accuro had done. So in terms of Accuro specific resources, and this will be in the resource document as well, they have a learning academy that you can sign up for free with lots of training courses, videos, webinars, and handouts. And then brand new as of last week, they have an Accuro resources site, which has that Accuro Learning Academy rolled into it if you're signed up for it. So now we're going to move right along and we're going to get into Oscar EMR. So within Oscar, you're going to want to use the prevention module in the CPP. So that's right up here in the upper left-hand side. If we're using things like social history and medical history, you can type whatever you want in there, and it makes it very, very difficult to find that information later. Whereas when you're using the prevention module, you can see the screening status, including if they're pending or excluded. It's not free text, and it's kind of automated for you. And has color-coded text or a visual cue of the status. So red is showing the preventions that are overdue. Blue is showing the ones that are up to date. Where applicable, it'll show you the date that it was done as well. When we're looking to the preventions here, we can open up the prevention window, and this is going to give you the recommended preventions for your patients, but you can also have a look at what's most recently been done. So this patient's never had the fit. They did have a PAP, and here was the date. There could be more than one running across. If I hover over this date, it will give me this additional information. However, if I actually click on PAP or whichever it was, we can actually get into this window here to document completed, pending, add comments. A really helpful piece here is the set next date. So if you had a patient who had an abnormal result, for example, you could set the next date for 6 months from now. And then this is going to bring that overdue flag into your prevention module in that timeline. There's also a couple of new options that are available in Oscar Pro. So one of them is prevention billing settings, and this is to help use the Ministry of Health tracking codes to track cancer screening where appropriate. So if you're using those codes to identify when patients have met or been excluded from screening, this will assist with billing those codes. It does not assist with billing exclusion codes when entering information in the prevention module. What happens is once a completed screening is documented, then it's going to complete the cycle for you. So here we would just put all prevention billing auto open to yes. There's a long list of the preventions. So in this example, we've got mammogram, there's the Q code, and it's going to bill to OHIP. And then once that actual completed screening is done, so here we can see it was completed, it's normal, this window is going to pop up to help you with that billing. There's also a prevention warning of a stop sign in Oscar Pro, and this provides additional decision support to help manage cancer screenings. So when it's enabled, you're going to have this stop sign that's going to appear when you're booking an appointment on a patient, and that's happening because we have display on appointment screen enabled. Again, this is working with that prevention module, and it's going to be set for each cancer screening. So one for mammogram, one for PAP, et cetera, but it's going to impact all users at the clinic. So you'd want to have that awareness as well. When we're looking to the reports section of the EMR, number 11 is your demographic report tool to build out order sets. And it may look a little bit different between Oscar Pro and Classic Oscar as well, but they're built for each prevention type and for each of the physicians. And then again, under the report section, under your main dashboard, number 13 in the reports We'll let you generate a patient list of eligible patients, and then it's going to have the color coding to show the status of the patient. So here we've got a patient set and a query for mammogram. Here's the patient list of those with no info, overdue, refused, etc. There's also a report by templates or RBTs. They may already exist in your system, or you can import them. This is an example of the CQUIP breast cancer screening report, which you'll have available to you as well. So when we run this report for the specific as of date, we get this list here that kind of shows you, we see that they're not refused, you have your patient list, and it does have a demographic link as well so that you can jump to the patient's chart. Ticklers are immediately under the prevention modules, and these act as reminders. So patients whose screening activity doesn't follow guidelines or pending tests. And then once the date arrives, so in a tickler, you can set what the service date is. And once that date arrives, it's going to appear in red in the e-chart, and it's also going to be displayed here in your tickler inbox. Ticklers can be edited by clicking on the tickler heading in the encounter and complete it as required. You also have the ability to edit or you can complete ticklers as well from our tickler list there. And that's viewing your tickler report to view all of that activity. So reviewing HRM reports is done through the inbox or clicking on HRM documents within the e-chart. They are labeled with a class and subclass from the sending facility, but you do have that set description field up here where you can manually type in and hopefully using standard nomenclature to note exactly what that is. For this session, I just put enter your description here so that you can see how that would look in the patient's CPP. And then here's kind of your list of different reports that you can go ahead and do your categorizing for. So in terms of OSCAR for resources, there's World OSCAR where there's RBTs that you can download, knowledge base, there's manuals and so forth that are all available to you. So that could be quite helpful. In terms of TELUS PS Suite, you're going to be using the problem list or history of past health. Again, standard nomenclature, or when we're looking to the problem list here, or both of them, even the history of past health, you can actually associate the diagnoses codes to them. So here we can see some text in blue. We know that that means it's a manual entry. Here, this patient's excluded because they have ulcerative colitis. It's in black text. And when I click on that, we can see that it has an associated ICD-9 code, and that's why it's in the black text for you. In the history of past health, so if a patient was excluded because they've had a total colectomy, you can do an associated diagnosis, your ICD-9, ICD-10, SNOMED, or your NCODES, or you can free text into there as well. And then that gets captured on searches and so forth. So when we look to searches to find patient populations, you may have some that already exist within your system. You can also either build them if you have the permissions to do so, or you can import from other users as well. So when we generated this patient list, for example, it was the CQUIP colorectal cancer screen overdue. At the top of your patient list, you always have this report button here. And what that does is it allows you to do some mass actions. So you could do a form letter or an email for all of the patients found on your list. Again, you want to use your secure messaging platform, or you just use this list to call your patients. You could include some additional comments. So if you're using custom vital stamps to document calls and so forth, you could actually build in or have someone build in for you columns to capture that data as well. There is the preventive care summary report. Again, this is to help with calculating preventive care screening bonuses for enrolled patients. So we're not using this to find every patient who is clinically needing screening. But basically, when we generate our preventive care summary, we can see this is a lab environment, so there's not many patients in here. We have one patient that is eligible for their FIT. And then when we click on the one that's not been done, we get that patient that appears in a list for us, or whatever number of patients you have. You want to make sure that you are labeling reports or results with proper categories and subcategories to file to the chart. So in terms of your HRM or your scanned or faxed documents, you would just use these drop-down menus to put in your appropriate category. In this case, we have diagnostic imaging. And then it will bring up the appropriate drop-down list. You can see to the right, mammogram is highlighted because I clicked that off of the list. So you can do that for HRM reports or anything that's been scanned into the chart as well. There's also toolbars and global reminders for point of care information on cancer screening. For the most part, they're programmed to follow general provincial screening guidelines. So like your FITs every 2 years, et cetera. And once the report or result is categorized, filed to the chart, or if tracking codes are also billed, you have a reminder that corresponds that's going to go away. So how this works, and this is a very simple, basic toolbar. For this particular patient, she's of the age where she would get all 3 of these screenings done. She's never had a FIT done. So once we identify this patient is overdue for it, the reminder is going to show as overdue for colorectal cancer screening. But once that FIT hits the chart and it's categorized and it's, a valid result, then that reminder is going to go away for a period of 2 years or whatever their screening timeline is before that reminder is going to automatically appear. So that's using that native functionality. You can also create quick patient personalized reminders as well. So a patient who's following a different schedule. And then you can run your reminder reports as well so that you're able to follow up on them. We can do delayed messages. So basically you can send a message to whomever, and then on the due date, it's going to appear in their inbox, and then they know to follow up with the patient. They're also visible in the patient chart, and it's a lighter shade of yellow so that you can differentiate that that's something that's future facing. And then there's different ways to track that a patient was contacted. So you might be using custom vital stamps that could show things like a patient was called or they declined or whatever it might be. This gets stamped into the progress notes and you could go ahead and type in additional information. Or there's also your EMSA tracking form that can be used. This is a nice little snapshot of things that they may be overdue for, and you can see the last result date of things that are up to date. And it gives you an opportunity to document what the status is. If a patient declined, you could put in the reason for that and so forth. So this was developed by AOHC and is very widely used by AOHCs, CHCs, and MPLCs to do the tracking. And then these are things that could be tracked using a search to find them. So it's a very high level overview. Tests can be tracked as pending, and it follows kind of a manual process as well. So your lab tests are tricky to do. This is something where, if you're not sure how to do it, you might want some hands-on support to help you out with that or to view some of their recordings. But you can also track referral letters and so forth. So basically what you would do is open up your pending tests and consults. And this is where you could choose what it is that's being done. So in this case, a mammogram. In the chart, we're going to have a stamp that the mammogram is not yet booked. And then we have this tracking form here to follow up with all of the different steps. So has the patient been notified? If the clinic is informed of a date and time of an appointment, you could enter that all the way through until it's completed. That manually needs to be done to keep changing the progress of this. So it would move kind of from not yet booked to the appointment date to when it's completed and so forth. There is the referral tracking widget that's available on the main dashboard as well. And basically what this is going to do is show you, letters that you have to create, letters to send all the way through to results that are overdue. And then you could use a search or a toolbar button to search for pending tests and consults. And that's a very high level overview. Resources that are available right out of TELUS on their main dashboard, they have help. And you would click on show help, and there's lots of useful videos, e-learning courses, manuals. There's also a link to the custom forms library where you can preview or download into your EMR. And the TELUS Health Community Portal, there's a large community there with lots of resources and tools, etc. So some overall tips and tricks, and just kind of recap what we've talked about, is you want to start small. You're not going to ever be able to fix everything all at once, right? So in data quality, we might start with the patient panel and then look to standardizing documentation in the same place within the EMR all the time. And you can think outside the box in terms of how to do this, because you might have a student or volunteer that can assist, or again, we can just start with a certain number of charts per week. And in terms of starting small, developing new workflows, you may start with one cancer screening. You know, if you've already got your workflows in place, you could maybe start with one cancer screening and see if you can tweak it out and then roll out to the others. Or even if you're developing new workflows, start with one, develop that workflow, make sure that it's working for you, and then roll out to the other cancer screenings as well. You want to be consistent, so use that CPP in the EMR, use standardized nomenclature across the practice. It's going to make it so much easier for you in future when you're trying to find populations to follow up with. And it's most helpful when you are with your patient and you know exactly where to find the information that you need quickly. Involve your staff. So this is a good way to allow a staff member to utilize skills. You may have someone who's awesome with Excel and they can create all of these beautiful visual graphs and charts and, you know, document things that happened along the way with annotations. Or you may have your social butterfly who's really good at doing those reach outs and the calls and having those hesitancy discussions. So they also have insights that you may not see. So from a physician perspective, it may look like this workflow is perfect, but when you talk to your staff and see what they're doing on a day-to-day basis, maybe there's a better way to do things. And it helps empower them because they're helping to improve cancer screening process. So there's a lot of pride that's also involved in that. It is definitely going to make it easier to have them involved for future initiatives. You want to ensure staff members are clear on their roles and responsibilities, and wherever possible, cross-train, because we can share the workload and also make sure that illnesses or vacations are covered. Track your progress along the way. It's always nice to look back and see how far you've come, but those little documentations about the things that went really well or the things that maybe didn't go so well are definitely things that you may want to refer to in future. You want to have your patient prepared, or your staff prepared for hesitancy discussions and being mindful and respectful of cultural or personal issues. And so you're empowering staff with the knowledge to either have that discussion or say that they can speak to the clinician. And it also empowers patients because they're making an informed decision about their cancer screening. Shortcut keys are very valuable. So if you're a clicker, that's fine. You may find that there's some shortcut keys that are going to help take you to areas that you want to work on more quickly. And wherever possible, you want to use your drop-down lists or standardized templates, macros, stamps, all of those different things that are available in the EMRs. So I have talked a lot. We are now to the interactive Q&A session. So I'm just going to open it up in case anyone has any questions that they would like to bring up. Feel free to take yourself off mute and ask the question or type it in the chat box. And perfect. I've had a little bit of a screen freeze there, so I'm not sure if anyone heard. Just kind of opening up the chat box, or if you would like to unmute yourself and ask a question that you may have, please feel free to do so. Again, there will be the resources that I referenced throughout the presentation that are going to be available to everyone after as well. And everyone's quiet, and that's fine. And there was a lot of information that was provided, so I'm hoping everyone got something of value out of this presentation. And I know that I went through a lot of it quickly because we do have limitations on time. We're available to help you and we're happy to do it. This is what we love to do. So the time when we're presenting or we're working directly with you, that's our happy place. And you've got practice enhancement consultants across the province. Thank you for all of these really wonderful comments. Thank you. I'm just so honored that you were willing to take the time to participate during your lunch break. And we are
Perfect.
still on the interactive Q&A. I'm just going to put our contact information up there, but it will be available to you in that resource document.
That's excellent. Thank you, Lisa. I don't see
Awesome.
anybody coming off of mute, so I'm hoping that means that you've covered all the everything that everybody had questions about throughout the presentation. So just a reminder that for those that attended, if you could put your full name in the chat, just to make sure that you get a certificate of attendance, and that this presentation was recorded and will be posted to our YouTube channel. And we will also be circulating documents after the fact. So if you think of questions after this webinar is finished, please feel free to reach out to either myself and I can connect you with Lisa or another practice consultant, or we can facilitate another discussion.
Absolutely.
Perfect. Okay, well, that is great. I don't see any other questions or comments.
Okay, wonderful. Well, thank you again. I really appreciate the time. I know it's a lot. Everybody's busy, so thank you very much.
Perfect. Take care.
Thanks so much. Bye.